Come in.
Hi, Marcy.
Hi.
Hi, good evening. My name is Jason. I'll be a student nurse today. How are you?
Good. How are you?
Perfect. All right, so what brings you in today?
I had a bit of a headache.
Okay.
Occasionally.
All right. Have you been here before?
No. First visit.
All right, so what I'm going to do today is I'm going to do a head and toe assessment. It's going to take roughly around 20 minutes. Basically, it's just standard protocol to make sure you have a good bill of health. Okay. So just as it sounds, I'm going to start from the very top and work my way down.
Okay.
All right, can you state your name, date of birth for me, please?
Marcy Ellen McGregor, 10/31/1968.
Okay, very good. All right, so what I'm doing right now is I confirmed her identity. The patient is who I have on file. And as far as that goes, what I'm going to do next is, let's see. All right, well, I'm going to check your hair.
Okay.
All right, so what I'm going to do now is while I'm checking your hair, I'm looking for any infestations, any lice, discoloration in your hair, and the shape of your skull as well.
Okay.
All right. Everything on the head is good. All right, so what I'm going to do now is I'm going to ask her as far as the eyes goes, acronym PERLA. Okay, so I'm going to be checking to see if they're round, reactive, and the light is accommodating. All right, so. All right, so left and right eyes are round and they are reactive to the light, and pupils are a 3. All right, so right now what I'm going to do is I'm going to give you some coordinating directions. So what I'm going to do is I want you to follow my pen. So I'm going to give you, don't move your head, just
Okay.
follow the pen. So I'm going to start here, go here, here. All right, now follow the pen. I'm going to come closer to your face. Okay. All right, so I just assessed her facial movements. They are symmetrical and intact. All right. So the vital signs were completed before this, so I won't be doing that today. But her heart rate was 60 beats per minute. Blood pressure was 180 or 120/80, which is all within normal range. All right, so what I did just now with the pen, it was her 6 cardinal fields of gaze. She followed my fingers. Everything appears to be normal and in rhythm. And her pupils were 3 millimeters bilaterally constricting equally. Okay. All right. So what I'm going to do now is I'm going to check behind your ears,
Okay.
and I'm going to check for tenderness and discharge. All right, they appear to be good. All right, now I'm going to check to see if you have any tenderness in your face as far as like your sinuses goes.
Okay. No.
All right, so your nose doesn't appear to be deviated. Okay.
Okay.
All right, so what I did now is I was expecting the external nose for symmetry, no deviation. And also I just palpated her frontal and maxillary sinuses. All right, and she has no tenderness, so everything appears to be normal so far. So next, I'm going to move to the mouth and the throat. I will be inspecting the lips to see if they're moist and pink, which is normal. And then I'm going to check her teeth to see if she has any cavities or any abnormalities. So let me get a light. Easier. All right. No cavities, no lesions, no discoloring in the mouth. All right, now I'm going to check the tongue. All right, can you do me a favor, move your tongue from left to right, up and back. Stick your tongue up for me, say ah. All right, tongue looks good. All right, so now I'm going to check the neck. I'm going to be inspecting and palpating the trachea to see if it's midline. Trachea appears to be midline. Okay, so then I want to ask her to turn her head to the left and right, up and down. Also, I'm going to check her jugular vein to see if she has a JVD. Okay. While I'm here, I'm going to ask her to do some facial expressions to check for symmetry and signs of stroke. So can you make an angry face for me? Can you smile for me? Happy face? Look surprised. All right, puff out your cheeks so I can hold your breath. Okay, perfect. Face symmetrical seems to be normal. All right, so I'm going to do a shoulder assessment. So basically, I'm just going to ask you to do a shoulder shrug to see if you have any, to see if your strength is symmetrical. All right, so do me a favor, shoulder shrug for me. Okay, relax. Okay, so what I did just now is she shrugged her shoulders. They were against resistance. Strength was equal bilaterally. All right, now I'm going to palpate her cervical lymph nodes. All right, there's no enlargement, so that's normal. All right, so next I'm going to inspect her upper extremities. I'm going to do skin. All right, no cuts, lesions, no discoloration. And then I'm going to check her nails. All right, and let's see here. There's no lesions, there's no swelling. Capillary refills. We do each finger. All right, capillary refill is -3. All appears to be normal. All right, now I need you to do a hand resistance. So what you're gonna do is you're gonna push off like this for me. All right, now you're gonna pull in for me. All right, now I want you to squeeze my fingers as hard as you can. Okay, strength in the upper extremities appears to be normal. Okay, 5-5 bilaterally. And then moving forward, we're gonna do the posterior thorax and lungs. So what I'm gonna do is I'm going to check her thoracic shape, her skin integrity, and I'll be palpating for tenderness. So, don't move these falling off of there, forgive me. All right, so like I said, I'm going to be palpating for tenderness, and I'm going to be assessing the symmetric chest, and then, so basically I'm just going to ask her to take a deep breath and inhale, exhale for me. Okay. Deep breath for me, please. Exhale. Breathe for me. Inhale. All right, so the aortic area, which is the second right intercostal space, is clear and in rhythm. The pulmonic area, which is the second to left intercostal space, is clear and in rhythm. And then the herbed and tricuspid area, which is the third and fourth intercostal space, is clear and within rhythm. And then the last was the mitral area, which was the fifth and left intercostal space. All right, and then the S1, the S2 is present. I didn't hear any abnormalities, which would be like a murmur, for instance. And then I'm going to do the bell to assess for bruits and extra heart sounds. All right, so while I was assessing her abdomen and her chest, I was expecting for contour, symmetry, and skid. So as far as auscultating bowel sounds in all 4 of her quadrants, I didn't hear anything, but I'll show you again in case you didn't see, because I just realized I was blocking the camera. All right, so when was your last bowel movement?
Yesterday,
All right, and do you remember the color?
brown.
All right.
Mhm.
Okay. Any problems with that? It goes
No.
daily? Okay. All right. So as far as palpating or auscultating, bowel movements are clear. Sounds healthy in that department. So we're gonna move forward to the lower extremities. All right. So what I'm gonna do is the lower extremity. I'm gonna look for edema. I'm gonna palpate her dorsalis pedis, her posterior tibial pulses. I'm gonna do them bilaterally, and then just like the fingers, I'm gonna do in the toes for capillary refills. They need to be under 3 seconds. Okay. So, and also I'm gonna check your range of motion and your strength. So, if you could do me a favor, I'm gonna pull your feet like this and need you to push out. All right. And now I need you to resist and pull in. Okay. Now I'm gonna do capillary refills in your toes. All right, so -3, they appear to be normal. And while I'm here, I also want to check your range of motion in your knees. Okay. Okay, can you lift your leg up? Okay, down. Any pain there?
Mm-mm.
Can you do this? All right, down. Okay. All right, you straighten your legs back out. So I just realized I forgot to do range of motion in her arms. So I'm gonna go back and do that while I'm here. All right, if you do me a favor, can you touch the sky?
Mhm.
All right, lower your arms. Now act like you're Superman. You're flying. Spread your wings. All right, close your arms. Okay, any pain there?
Mm-mm.
All right. Now I'm gonna check her. I'm messing something. Okay, I know what it is. Do this shape for me, please.
Oh.
Okay, you know what that means? Yeah, it looks good. All right. Believe it's clout. Or clout is no clout. All right, and then I'm missing something. Okay, tell you what, it'll come back to me, but right now we're gonna check out your gait, make sure everything goes there. Have you done this before?
Mhm.
All right, can you do me a favor? Swing your legs across on the bed like this.
Sure.
Feet flat on the ground. You need equal balance. You feel
Mhm.
okay?
Mhm.
All right, so I'm gonna wrap this around you. Is that too tight?
Mm-mm. Feels fine.
All right. Make sure there's enough room for 2 fingers. All right. On 3, I want you to stand up for me. Ready? 2, 3, go. All right, I'm gonna walk to the door. We're gonna turn around. All right. And gently have a seat for me, please.
Okay.
All right, I'll take this off from you. All right, you can lay back down. How do you feel?
Good.
Feel my head or anything?
No. Mm-mm.
All right, gait appears to be normal. She's able to stand. So what I need to do next, I just remembered I didn't check her posterior, her breathing. All right, if you can do me a favor and sit up for me, please.
Sure.
All right, so what I'm doing now is I'm auscultating the anterior lung fields in 4 locations. Correction, there's 6 locations, and one on each side. Okay, you can lay back down for me, please. All right, breathing is clear and in rhythm. All right, now I'm gonna do a quick, let's see, we did head, we did face, we did range of motion, capillary refills, checked your hair. I think that's everything we covered today. Do you have any questions, concerns, or complaints?
No, everything's fine.
All right,
Much
awesome.
better.
So what I'm gonna do is I'm gonna check in with you in about an hour,
Okay,
and then I'm gonna give you the call bell
okay,
if you need anything. I'm also gonna lower the bed all the way down for your safety.
thank you.
I'm gonna put 3 guardrails up, not all 4. And other than that, that's all I have. If you need anything, please let me know.
Okay,
And as I'm leaving, I'm gonna perform hand hygiene. And it was a pleasure meeting you.
thank you.
So have a good.
Thank you very much.
See you soon.
Mm-hmm. That's good.